In this video, I will demonstrate 5 exercises for peripheral neuropathy. These exercises are designed not only to improve strength and flexibility in the legs and feet, but also to enhance balance and circulation in the affected areas. Symptoms of peripheral neuropathy include things like numbness and tingling in the feet and legs, muscle weaknesses, even balance issues. In addition, peripheral neuropathy contributes to difficulties in coordinating movements and adjusting your balance. This is why having a set of exercises that enhance both balance and coordination is essential for improving the quality of life and managing peripheral neuropathy effectively. The secondary benefit of exercise is that the movements also help improve and enhance blood circulation in the legs, the feet, and the toes. This is crucial in peripheral neuropathy because adequate blood flow supports nerve health, and it can help alleviate symptoms such as numbness and tingling and burning, promoting overall healing and function. And that is exactly what these 5 exercises I'm about to show you are designed to do. In a moment, I will demonstrate these 5 exercises for peripheral neuropathy, outlining how to do them properly and safely so you can begin to improve your balance. I will also share with you a patient success story of Patrick, who had difficulty with his balance and depended on a scooter just to get around because of his peripheral neuropathy. So keep watching. Hi, I'm Dr. Ole Olson, America's neuropathy coach. For almost 20 years, I've been helping patients deal with peripheral neuropathy. I've assisted thousands of patients and taught hundreds of doctors nationwide on how to manage this condition gently and effectively without the use of drugs or surgery. I founded Asuta Health, which has now expanded to 5 clinics across the Midwest, specifically focusing on serving and treating individuals with peripheral neuropathy. I chose the name Asuta for its meaning to be healed, reflecting our deep commitment to healing those afflicted by this debilitating condition. Recognizing the difficulties in managing constant pain, the scarcity of widespread knowledge among healthcare providers, and the ongoing quest for effective treatments, this channel aims to bridge the gap. Our mission is clear: to offer hope and relief to everyone suffering from peripheral neuropathy. Now go ahead and smash that subscribe button below if you're looking for breakthrough treatment methods that can significantly reduce your neuropathy pain and improve your daily life. I upload a new video every week. In addition to that, I also wrote a book called Reversing Neuropathy: Key Components for Getting Your Life Back. You can get a free copy at the link in the pinned comment below. Now, why is improving balance and coordination so important if you are suffering from peripheral neuropathy in your legs and feet? Well, most neuropathy patients don't know this, but more than 1 in 4 Americans age 65 plus fall each year. Falls are the leading cause of fatal and non-fatal injuries in older adults. Over 3 million injuries from falls are treated in emergency departments yearly, leading to over 800,000 hospitalizations. Death rates from falls in older adults increased by 30% from 2007 to 2016. Because of this, I want to stress 3 key points. First, balance is very important to work on, no matter your age. When I was in school, I would train my balance almost daily while working as a personal trainer at a local health club. When I moved back home to start my practice, I was very busy working and I got out of the habit. About a year into clinical practice, my father made a balance or a wobble board for me, and I was super excited to jump on, and then quickly realized how fast my abilities had deteriorated, even though I was only in my mid-20s. This leads to point number 2. Use it or lose it. Even more important when we're dealing with damaged nerves, we have to continue to get these nerves sending signals to and from our brain and the body, so that way they're communicating on an effective and efficient basis. And then thirdly, reducing the risk of fall can not only reduce your chance of injury, but can also prevent death, just as we had discussed. As you can see, having good balance is not only essential for a great quality of life, but also for preventing serious injuries and even death. Now, let's dive into these 5 exercises that will help you improve your balance and coordination. Exercise number 1, the single leg stance. With this exercise, you want to stand near something that you can hold on to when needed. Could be a countertop, could be a chair, or even a handrail. Anything that's stable enough to support you, because we don't want to risk any sort of fall. What you're going to do is you're going to set a timer on your phone or your microwave for 60 seconds. Lift one leg behind you and hold for the entire minute. Even if you catch yourself shaking a little bit or wobbling, that's okay. You may need to hold on to something for the entire time as we start off, but as you start to improve and get stronger, you will be able to start to let go and ease up a little bit. But we've got to get these nerves properly firing so your brain knows exactly where you are and what muscles need to contract. When you finish, lower your leg and then switch legs and do it on the other side. Exercise 2, standing marches. With this exercise, you're gonna start standing in place, once again holding on to something, and you're gonna lift one knee up towards your head to about waist height. Then you're gonna lower that back to the ground, switching legs and lifting your right knee up towards your waist and then lowering it to the ground. You wanna do about 10 to 15 repetitions on each side. Exercise 3, the tightrope walk, also known as the drunk test. While walking down a hallway, put one foot in front of the other. You want to place your heel as close to the toes in front of the other foot as possible. So repeat stepping with one foot in front of the other down the hallway, using the walls or a handrail to guide you so you don't risk falling. Once again, that's the most important thing here. We do not want to fall and cause more problems. Begin with about 5 to 10 steps for each foot. Exercise 4, toe taps. With this exercise, you're going to start by holding on to something and lift one leg in front of you, touching the ball of your foot up onto a step or a stool, and then lower it back to the floor. We're going to switch legs, lift your opposite foot up, touch the top of the stair, and then back to the floor. We're gonna do this about 10 to 15 repetitions on each side. And the last exercise, side leg raises. These are very similar to the single leg stance we talked about earlier, but instead of lifting your foot in front of or behind you, you're actually gonna lift it out to the side. Now, be very careful. We're going to be activating some different muscles here that will help us to stabilize our body while walking. So begin by lifting your left foot out to the side and then back to the floor. Lift your right leg out to the side, back to the floor. Just raising these legs as high as you can while maintaining good upright posture. We don't want to be bending over. Don't forget, safety first with all of these. So hold on to a chair or something so you don't risk another fall. Here's how to implement these 5 exercises into your daily routine. First off, start small and build up. Don't overdo it, as I frequently do with things, and create more issues. So slow down, be slow and steady, building up over time. The second thing you want to do is find a time in your day and stick with it. Routines, or habits, are key to implementing any new things into your life. I like to use my phone to set reminders for myself throughout the day of things that I'm trying to implement, like taking my supplements, working out, reading, whatever it is that I'm trying to add into my routine. I like to set those reminders. And lastly, don't give up. Some of you have been dealing with these things for a long time. There are answers out there, so keep looking. These exercises will not fix things overnight, so be diligent and use them for a few months before you decide if they're helping. It's good to do a little bit of an assessment before and afterwards to see how things are actually improving, because sometimes how we feel can change drastically from day to day. And that's exactly what Patrick did. When Patrick came to our office, he was dependent on his scooter and his wife to get just about anything done on a day-to-day basis. After taking him through an assessment and determining that he was dealing with peripheral neuropathy, we put him on our neuropathy relief roadmap, which included some of these very balanced exercises that I just shared with you. After about 6 months, like I said, this isn't a quick fix thing. I will never forget the day he came back into the office. He was using a walker now, no longer needed his scooter, and he was smiling from ear to ear. I couldn't have been happier in that moment to see the progress that he had made, not from something we did, but from putting in the work. So don't give up, keep fighting. Now, you have a set of 5 exercises that, when done over the course of several weeks and months, can significantly improve your balance and coordination. So give these exercises a try and let me know which one is your favorite. Is it the single leg stance or the toe taps? Leave a comment below and let me know. If you found value in this video, please like and share so others suffering from peripheral neuropathy can discover these balance improving exercises. Be sure to subscribe to my channel to get more breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. The next video you should watch is this one right here. If you want to get my 3-step home care program for peripheral neuropathy pain relief, go ahead and watch this video next.